Hello and welcome back to Lamu Podcast Talk Show. Today is our next episode. Here we inspire, inform, heal, and transform lives through conversations that matter. Yes, I'm your host, David Nyamrangwa. Still, I'm joined with Sao Turuchi Lopita Jr. Yeah, today we shall be talking about our healthcare system in Uganda. Are we happy with the service delivery in our hospitals, especially the public hospitals? Are we happy with the status quo of our services, even in private facilities? Are there challenges that we are seeing that needs to be addressed? If the walls of Mulago National Referral Hospital, the bricks of Lacho Hospital in Gulu, or the wooden doors of Health Center 3, the Health Center 2, deep down in Namutumba, if they could speak, what would they say? Would they speak or tell stories of triumph, or would they cry out of exhaustion? What would they say? So today, those are the stories we want to talk about. We don't want to sugarcoat anything. We want to talk about the challenges, the good things that we've been good at as a country, as a government. What have we been good at? And those are the things we want to talk about. So as we kick in, I want to ask my colleague here. So, are you happy with the current status of our healthcare here in Uganda?
Absolutely, I'm not happy with the way how things are done, most especially in our healthcare system.
Tell me.
Maybe I think I might use English and you say that maybe I'm happy about it. You know, most of the times when you're annoyed, you normally want to express yourself in your local language or the language that people can understand. Amazima amatuufu gali nti engero healthcare systems oba engero ebintu by'obulamu n'okujjanjaba abantu mu Uganda gye bitambulamu si nnungamu ate si nnungi. Buli omu ali eyo yeemulugunya nkimanyi kubanga naffe bewandigambye nti twasoma tuli mu field y'obusawo tubiraba ne bitukwasa ennaku ne bituleetera okwenyamira ne tugamba if you don't talk about them who will come out and talk about these issues. So for sure, yes, we know there has been progress. We can't say that there are only bad things. Progress has been there, but where Uganda is right now, the level where Uganda is, truly we should expect better service delivery. We should expect the best always, and when it comes to these sectors that matter a lot, talk about the health care sector, it is really lacking. Sigenda kugamba nti oba sugarcoating oba kino ngambe nti lwakuba ndi musawo oba lwakuba ndi mu field eyo, amazima gali nti tuli bubi era twetaaga improvement.
Webale nnyo kati before we go further to this conversation, I want us to be able to understand the structure of our healthcare system here in Uganda. How is it organized? How are we organized? When you want to seek care, where do you start from? When care fails at a certain level, where do you go next? So those are the things we want to understand. And briefly with my colleague here, we shall be able to take you through our current structure of our healthcare system here in Uganda. So to kick off, we have a body that controls the entire system or the entire healthcare, and that is the Ministry of Health. So it sits at the very top of our healthcare system here in Uganda. So it is in charge of planning, in charge of course, strategic planning, implementation, in terms of resource mobilization, overseeing all the service delivery at the different levels of these different health facilities. Yes, so that is the Ministry of Health, which is the body that regulates at the very top. Then when we come down, that's when now we go to the national level. So at the national level, that's when now we start seeing the national referral hospitals. And these are 5 of them in the country as we talk right now. So do you know any of this?
Yes, we talk about Mulago
National Referral Hospital. We have We have Chirudu National Referral Hospital. We have Butabika National Mental Referral Hospital. Then we have what else? What else we have?
I think the next one is Mbalala.
That is a region. It's a region.
It's a regional hospital. National referral hospitals, I think.
We have Kawempe.
Yes.
Yes, there's Kawempe. Then also there's Chiru dimension. Then there's another one which was added. It is China Uganda Friendship Hospital in Nakuru. Yes. So those are the 5 ones that we have at the moment. Yes. So those ones they offer specialized care. Specialized care. So if you need those specialties in oncology, so we expect the services at that level to be at its very best. So all these other facilities down below, they refer to the national level in case anything else down here. Then when you go down, that's now we have the regional referral hospitals. Regional referral hospitals. These ones they serve the different regions and they are able to serve different districts. So you feel like one referral can serve the different districts. So we have about 16 of them. Of course, those ones also they deal with different specialties. So you have different doctors who deal with different specialties. Yes. They deal with general medicine, surgeries, everything. You can find them. Different diagnostic methods. You'll find them at that level. Then when you go down, we go to the district level where we have the district health services. So this one at the district, it is like the headquarters. So it does the work of the Ministry of Health, but at the district level. So they're in charge of controlling the district referral facilities. So that's why we have those. We have different facilities. There are about 47 of them as we talk right now. And in every district you will find those facilities, district facilities. So there are 47 of them as we talk now. Then after that, when we go down, that's when we have the sub-district, they call it the health sub-district. Health sub-district. So that's why now we have the health center 4s, health center 3s, the 2s, and the 1. So at the health center 4, those ones we shall find them at the county level. The county level. So these ones are run by the medical officers. Medical officers. So these ones they have a capacity of having admissions both inpatient and outpatient. They handle some operations because there's an MO, a medical officer, who can be able to do those operations, plus these other general services. Then below down, when we go to the sub-county level, we have the health center 3s. Health center 3s are run by a clinical officer. Medical clinical officers are the ones in charge of the health center 3s. So these ones, they also offer inpatient and outpatient services. They also offer these general services, the basic ones, immunization, maternity services, all these. Then below that, we have the health center 2s. They are run by an enrolled nurse, helped by a midwife. So those ones, you'll find them at the parish level. Then below, lastly down, at the very bottom, at the village level, that's where we find the health center 1s. These ones are the village health teams. Very important people in our villages. Yes, VHTs. I remember my father was one of them. Those ones are in charge of health education, linking patients to the nearby health facilities, teaching them on immunization, HIV, sanitation, all those things. Very important people in our villages. The village health teams. Very important. Yes. So briefly, that's how our healthcare system is organized. So when someone tells you that now you've been referred to a health center 4, so you know that you are at a given level, you've jumped from a health center 1, now you are at a health center 4. So that's briefly the structure. So now we want to understand how our healthcare system has been since independence. Since our colonial masters left us, we've had a lot of things that have happened, both good and bad. But we want to know, after the colonial masters leaving us, how was our system? Was it strong? Was it weak? Did they leave us with some things that we can still learn from? So do you have any clue about how our system was before, actually after these colonial masters leaving our country?
Yeah, of course, with the simple history that I learned from our very own people who were present by then, since 1962, you find that these colonial masters or these people that had colonized us left some healthy facilities, though they were unevenly distributed, and most especially, they were only in town places, neglecting the rural areas. Yeah, of course, that has been a great improvement right away from since 1960 what?
62.
Since 1962. Till when facilities started coming in, the government started constructing
new health centers, distributing them in different villages,
different places, different areas to connect everyone or the citizens to the healthy care network.
Yes.
From our Gundi, our 1962, then to 1970s, where we now had to enter the political turmoil, instabilities.
That was the most serious. It affected greatly our healthcare system.
True. It created a lot of gaps to even that some health workers had to flee from the country.
True.
Going to seek help or going for better opportunities to save their lives.
True. We saw hospitals running out of supplies because the supplies were taken to war to aid in the war.
True. So through that process and everything that happened in that period, 1970 to 1980s,
the early 1980s.
In the early 1980s, there were a lot of challenges in our healthy system.
And what I will tell you is, what we shouldn't forget, we should commend what the colonial masters left. Because our healthcare system, by then, it was strong. That's what I will tell you. It was a strong system. Because it was the envy, or most people in East Africa, they admired our system. Look at Mulago Hospital. By then, it was not just a hospital. It was a teaching center, and this hospital, it attracted people from all over the continent to come and receive care from here. So people came from all over the continent to come and receive care. So we looked at it as being a strong system, and also it was one that was really promising because we had great dreams about how our healthcare was going to be. Except now, when the war came in, a lot of things changed. There are a lot of challenges that kind of came in, the war affected us so greatly. Then now, when we entered into the 1990s, that's when now we saw HIV coming in, that pandemic. It really affected us also because we saw a lot of people dying because people were so ignorant about the pandemic. So we saw the death rate raising about 18 to 20%, even beyond. So many people died within that time. But I should commend the government by then. It did a great work in controlling the pandemic, because when you look at the figures, they dropped greatly after those coming years. Yes, we were affected when the infection came in, but we dealt with it. And most people in the world, they expected us to collapse within no time, because the rate at which people were dying, they expected us to die seriously. But we should really commend the government by then. They did a great work, because today we stand at about 5 to 6%. Yes, so we can see that there is a lot that has happened in terms of controlling the pandemic, and we shall see different things that the governments have been good at in terms of controlling, especially in these pandemics. Yes. Yeah, so that's briefly how our healthcare has been since independence. So we want to look at the good things. So do you think there are good things that really our government or our country has been good at in terms of service delivery, healthcare wise? What have we really been good at? Or we only have challenges?
No, it is not that just that we only have challenges. There are a lot of good things that the government has done for its citizens to get the care they deserve. Though challenges are in there. Talk about the funding, financial gaps in our system, and then talk about corruption. Those have been actually the very issues that had affected our healthcare system and the service delivery in our healthcare. The good thing that the government has actually done, you will find that by then the number of hospitals and wound and maybe health facilities that were present by then,
the numbers
have now doubled, not actually doubled, but tripled. So the government has been good at that, increasing on the number of facilities where people can easily do what?
Yes.
Access
until today
healthcare.
Yes, until today we still have a lot of facilities that are being brought up, especially the health center 3s and 4s. Then we have the regional referral hospitals which are being renovated and they are being supplied with the necessary supplies, and also the staffing is also improving. So we should really appreciate
the government for that. I think that has been a great improvement and a great achievement by our government.
Yes.
Then, to talk about another good thing is that we have seen some improvements in funding these sectors of our healthcare systems. I think from the start, we could only see like maybe 2% or 4% of the national budget only being allocated to the healthcare system.
Yes. And you remember, Jukida, from the Abuja Declaration, we are entitled to have 15%, over 15% from the national budget. So if we are just at 2%, so you can imagine how far we are from that target goal of the Abuja Declaration, which is 15%.
I think maybe to make a clear point on that, I was reading in the financial year, this 2025-2026,
yes,
the amount of money they allocated to health, it was, I think, 5.87 trillions.
5.8 trillion shillings.
Yeah, that is equivalent maybe like $1.5, which is I think around 8% of the national budget. So we are still very low.
We are still down.
According to that Abuja Declaration, which is 15%. So you can still see that yes, there are some gaps, but they have tried to improve.
There is an improvement which is happening.
Then again, another thing is about how the government has been able to rob the public health fundings, maybe from
donors.
Yeah, from these donors, the whole support donors. These people have actually done a lot.
Most especially NGOs. Yes.
Yeah, most especially these NGOs. You go to Mulago Hospital, you go to these big facilities. There are those NGOs trying to help
to supplement on the domestic funding that we already have, which is not enough. So we can see there is that coverage gap that is being covered.
I think without forgetting the stability in political systems.
So,
because when you don't have that stability, trust me, there is no any system that is going to run smoothly. We shall always be hindered by those political instabilities. But because our government has been really good at keeping peace, I think that is why we are seeing all these going smoothly, like how they are doing how they are going. So we shall give credit on where
it is due. Yes, it deserves.
So, though, to talk about the challenges and the many, they overweigh the good things that the government has done in our
and let's get there. Sector. Let's start on them because I think that's where most of you want to come in. You've seen more bad things than good things, but at least we told you where the government has been good at. So let's talk about the challenges. What are some of those challenges that we've seen in our healthcare system?
Very, very many challenges. Ezimu otuuka n'ogamba naye ddala government etufaako oba just bo bali mu byabwe.
Have you watched about the video of a guy in Mulago who recorded himself when he lost his child?
I think that was Green Daddy.
Yeah,
I saw it.
You were mentioning this name, but of course it's public information. But for people who saw that video circulating over the internet, you saw how that guy was attacking the healthcare workers. People were saying he's attacking the healthcare workers, but there's something to learn. This guy was frustrated losing his child that time where the healthcare workers were not available to help. But of course, we should not also blame the healthcare workers. These people also, they get overwhelmed with the numbers. and also the environment they are working in is not really favorable for them. So we must think about the person who is offering the service. Have they really been motivated in the way they should? Is the financing okay? Are the supplies enough for the patients? Yes. So those are the things we have to look at.
When you look at actually our healthcare systems here in Uganda, let's talk about Uganda. It is a national referral hospital where you expect that facility to be very well equipped with working equipments, up to date and standardized,
The drugs,
with the drugs available. But you reach in the hospital, every drug is out of stock.
Nowadays, there is a saying that goes, I went to the hospital, the doctor prescribed for me the medicine, but he told me to buy it from a nearby pharmacy. And by the time this patient is going to the nearby pharmacy to buy that medicine, this buying just that medicine, it will cost him all the savings that he had. So he'll spend the little money that he had on just the treatment that he has been given. But imagine if we had the medicines in these hospitals, especially these big hospitals at least. We know the numbers can be so big, but at least let's have these essential medicines available.
Yes, for sure. That is a very big challenge.
Let's talk about the staffing.
Staff understaffing. Oh my God.
But we are many in the country, so we are so many on the street struggling. Why are you saying we are understaffed? What's the challenge?
When you look at the good at these institutions, ezifulumya abasawo buli mwaka. We have graduates.
Yes, so many on the street.
Osanga omusawo ali eyo mu kukoona eyo.
You know that up to now I still have the people I studied with, they finished with campus. They are still looking for jobs. They have never been employed.
That is very true.
But we are here complaining that the government public hospitals are being understaffed. So where is the challenge really?
Maybe let's bring out statistics. You see, like now, we say that the Basawos who are estimated to be in Uganda are about 160,000.
160,000.
Those are MOs.
Only MOs.
Now bring on clinical officers. Bring on the nurses, the midwives, all those. So if you were to add all of them, the numbers are very, very many. But when you go to our facilities, most especially public facilities, you'll find that the ratio of the doctor to the patient is actually almost like 1
to 25,000.
25,000.
Imagine.
And you ask yourself, when will this doctor rest?
And also think clearer for this patient to decide correctly.
Why? That has been the biggest challenge.
And according to healthcare, according to World Health Organization, they recommend at least one doctor should serve about 1,000. At least 1,000. But imagine 25,000 patients.
All being seen by one
doctor. That is serious.
You get it? I think the government should really become serious on this note. Mulina okubeera serious kino ekintu government the Ministry of Health.
We have very intelligent people in this country who can do a great work. But we have very old people who are still in this system. You get, they are not doing any work, they are tired. But we have fresh energies. People who are ready to serve this nation. Man. Then let's talk about the financing. I know we talked about it briefly. How is our funding? How is it?
Our funding is still below the required standard, where we say that now, according to what we refer to the Abuja Declaration, where we say that it should be 15% of the national budget, where Uganda we are about at 8.1%, which is really below the required the required percentage. So I think the government has to prioritize the public health care systems.
And still on that point, I want to look at the out-of-pocket spending of the citizens in Uganda. it is really huge. But when you look at the numbers, when you look at the donors, the donor funding, it contributes to about 42% to the healthcare system. Then when you go to the domestic or the government funding, it is just about 17 to 20%. So imagine. Then now when you look at the out-of-pocket spending, like me, I fall sick, I have to pay for every bill when I'm billed in the hospital. All that money that I spend. So that's all of it. It contributes to about 40 or 41 to 42%. So you can imagine how many people are struggling to pay for their medical bills. And just one medical bill can throw someone into their poverty, which they will never come out of all the entire life. So imagine someone has cancer. Someone has those chronic conditions like hypertension, diabetes. These people are always on medicine each and every day, and they have to spend whatever they have from their pockets. So how do you expect that person to become a rich person in future? So it's really, really burdening to see that we have a lot of people that are still struggling to pay their medical bills, yet we have a government that can find ways to be able to finance this system that we are in. Of course, there is the National Health Insurance System that was talked about. You remember in 2021?
I think also this guy, Honorable Lucy, though he didn't go through,
Sarah is told.
Sarah is told.
Yes.
We talked about it. It is one of the best things that the government can offer to do for its citizens. If you talk about the government coming out and saying that we are going to start up a national insurance system for the healthy care, it is going to cover everything on what? On health. You get it? Just because for these guys, for them, they have that money, maybe when they get sick, they are flying out of the country, going to Kenya, going to India, going to Australia.
But a common man down here is struggling. The story is different, man.
For sure. I think the government should really
and imagine,
look onto that.
You know, this thing has taken over 20 years actually. It started around 1980, I think. 1980 to be discussed on the National Health Insurance. It was brought in Parliament in 2009. That's when it was brought in Parliament to be discussed on. Then in 2021, that's when it was approved by the Parliament. I think by then it was the 10th Parliament. So they talked about it. It was passed. It was approved. But now it was sent to the president for it to be assented into a law. But up to now, we are still waiting for it to be put into a law so that everyone can be able to benefit from that insurance. Because here is how it works. So you, as a person, or as a citizen of Uganda, depending on how much you're earning, every month you're supposed to contribute a given amount of money. So that money, let's say maybe every month you're paying 15,000. You can pay 15,000 every month at least. You save it for your health care. So that money is saved every month, such that when you fall sick, you can visit any prescribed hospital and be able to receive the medical care that you want. Because it is really different when you just fall sick and you find yourself at that time you've run broke. But at least if you've been saving your money, you can just rush and receive care. It's like saving. When you have your money saved, that is an emergency fund. You can always run because it is a system. It's like the other time when we used, our parents used to pay taxes. Yeah, they used to pay. It was a must. We used to pay taxes. So this time round, it will be a must.
It is about because everyone
have to save, and it will be a must, by the way. So it will have its challenges, but of course we should embrace it because it is something that is good. So we should embrace it such that it can be implemented, and it helps us for a common man down there. Because if you look at the service delivery, it is favoring the rich. If you have no money, man, you will die. You will die in Mulago. You reach there, everything it needs money. You need to eat. You have to move out of the hospital. You buy it from a pharmacy. Even 30. The whole situation is really appalling. Any other challenge?
Of course. We still have that. Now, we are forgetting. Do you remember the panic that happened when Donald Trump said that they are withdrawing the funds?
So that's donor funding. True. So we still have over dependence.
Why are we still depending on those people? Yes, we need their support.
We need them.
But when they say that they can't afford to support us, let's be able to support ourselves. Why do we really have to suffer or have to cry out to them and kneel to them? And remember, these people, it's not that they are just going to give us for free. No, it's never like that by the
There are always strings attached.
There are always strings attached.
Because I remember there is recent funding that is coming in from USA where they are going to give us, I think they have already given us, I'm not sure. There's some money that they are allocating to healthcare. But of course, when I looked at the strings that are attached to that money, that funding, they are serious strings.
And even when you look at it, because previously they used to give us like some good money, but now I think they deducted almost like 1.7 trillion from that money they were doing what they were giving us.
So there are some terms and conditions. I think I saw they were talking about data sharing. There is some data that we're supposed to provide to give them the health, the patient data to them. Of course, it comes at a cost. We are looking at some exposure of our patient data to these countries that don't know us exactly. So it comes with challenges. So we should look at ways we can be able to fund our own systems as a country.
Corruption. In healthy care delivery.
I looked at the money that was being spent during elections, during campaigns. That money, if a portion of that money was allocated to healthcare, and moreover, what happens, what challenges me is this. After passing the budget, they bring a supplementary budget. They say now there's something that we forgot, now we have to add it there. They bring a supplementary, but you'll never hear a supplementary budget being brought on healthcare.
But to the parliament, just for the healthcare,
nothing.
So please, from the top officials, from the Ministry of Health, can we really have a very good surveillance on the allocation of funds in our systems?
Because really we are struggling as a country. Because at this level, we shouldn't be comparing ourselves with independence at the time of independence. We are at a given level. This is a technology, information technology era. A lot has happened. People are informed. People are informed. A lot of things have happened. Other countries are very far in terms of service delivery. But if we are still talking about staffing, we're still talking about funding. Such things should have really improved at this time. A lot should have happened.
Then you talk about the high disease burden. High disease burden. By the way, when you look at the way how the communicable and non-communicable diseases are progressing or are rising in us Ugandans, you ask yourself, and maybe to exclude communicable diseases,
but the
non-communicable diseases, like the likes of cardiovascular conditions or diseases. Talk about hypertension, talk about diabetes, cancers. They are at rise. Please, yes, I know the government, you're not the only one who is supposed to be answering on this. But then again, we attribute it to you because why? You are the ones who are responsible to educate the citizens.
Primary health care.
The primary health care.
But I get challenged when the government undermines the work that is done by these village health teams. They are not financed. Look at the clinic officers. Nowadays, there is a battle that is going on between the MOs. There is a gap that is being left. And we're doing a great work in our communities. So imagine,
but very many people
undermining the work. Yes. So imagine if the government really said that let's invest more in primary health care, where we have people who are located to just teach people about prevention, only prevention. And then observe after 10 years the rate at which these diseases will be able to reduce. So there is something that needs to be done in that area.
I was reading and I came to know that in was it 2019 or 2022 there, almost 36% of the total deaths that happened in our country were attributed to non-communicable diseases.
That's a huge number.
Everyone is dying of hypertension, heart diseases,
Depression,
diabetes.
those things.
You get it? So I think truly we need to look into that as healthcare workers, as the government at large. The rise or the rising of these non-communicable diseases, they are actually alarming, or it is alarming. So we truly need to address that.
Okay, Kari, thank you so much for this. I feel you should give your remarks as we summarize this. What would be
And I think without forgetting this,
yes,
I don't know why the government has to say that they are going to put a facility in Kayunga, whether it is a health center 1 or a health center 2, and they leave the infrastructures to break and rot without renovating them, without even putting there a simple equipment that can check someone's blood sugar.
And they expect people to visit that hospital or that facility.
The government, why? Mubigaleko tukimanye nti tebiriiyo. Omuntu osobola mutambuza n'omutuusa ku ddwaliro oba ku gundi ku health center 1 or health center 2 n'avaayo nga tafunye na Panadol, nga sukaali tebamukebedde, nga n'ekyuma kya pressure kyafa.
But that's the thing that is happening in most hospitals. You reach there, they'll tell you now our scan machine is not working. So you are sent to a private hospital to do the investigation. So a lot of things need to change.
I ask myself, why is that guy or is that patient, that citizen, has to walk miles to come from that far, just only to come and be checked for blood sugars and hypertension? Things that can be done even on your bedside. The government, for sure, you are neglecting those health center 3, health center 2s and health center 1s. Because I don't know whether you don't see the value. I don't know why you try to say that maybe let our fathers and our grandmothers come and flood these private hospitals in Kampala or go to Murago. I don't know, but I think that is one of the biggest challenges that our health care and nadala obutono obw'omukyalo
health center tools
ate bw'oba bwennyini abantu bwe basookerako kubanga bwe muliraanye oba bwe muli kumpi, it is the one that is near them. So why don't you equip them with at least these simple drugs, at least with a nurse, at least with a clinical officer who is always there with these simple machines. They can comment what. I'm very sure the citizens will be happy and will appreciate your services.
Okay, your final remarks.
So my final remarks, as we conclude, we call upon the government, the Ministry of Health, the medical fraternity, everyone
The patients inclusive.
If you know that your voice can make a change or can make a difference, please don't sit and see our healthcare system collapsing. Because medicine is one of the backbones of any country. Another thing is, why don't we equip our hospitals, build them to standards where you want them to be, as those in Kenya, where every minister has to fly to go to Kenya to get that medical attention? What is not here in Uganda? Is it land?
Is it the equipment?
Are they the supplies? Is it the money? Why? Why can't we say that maybe the next upcoming financial year, let's allocate the 15% that is the recommended percentage of our financial budget.
And we see whether it will not do some work.
This thing shall not work. So I call upon everyone to join us and we fight this battle together. We are fighting for our citizens, we are fighting for our moms, our dads, our relatives,
grandchildren,
our grandchildren, and us ourselves. I wish you well. Have a nice evening.
Thank you so much, Mr. It's been a really educative session. And of course, I want to stop to say that if our hospitals could speak, they would ask for one thing, that's accountability. Accountability. To an extent that if you reach the hospital, you reach that facility in your village, one thing you want from that place is healing and not mourning. You don't want to see people mourning from health care facilities. You want to see people who come to seek for life or ulamu. Life should start from there. Very simple things that really that can be provided for our current system. The system is in place, but we need things to be put into action.
Everyone dies. It's okay. We can't stop this, but we can at least manipulate it.
Postpone it.
Omuntu ne bw'aba ng'aleese mu Uganda oba mutuwe mu ddwaliro alabe nga waliwo okufaayo. Let them not be neglected and they feel that they have been neglected.
Have you ever worked on a patient? On a patient. The patient reaches a point they die, but the caretakers, they feel they are happy. You've done your best. And they feel they are satisfied that their person has died when he's happy. So that's the kind of services that we need from our public hospitals. Those are the services that we need from our government hospitals. So please, stakeholders, our government, the leaders, the politicians, please, all responsible people, if you have a voice, please, let's talk about these issues. Uncomfortable as they may sound, but let's speak them because you never know. At a given time, things will change. So thank you so much. This has been our episode. I'm grateful that you've been able to tune in, and I hope to see you next time. Thank you.